September is Pain Awareness Month, and did you know that 3.3 million Americans have chronic migraine 1, which means they experience pain from headaches or migraines for more than half the month? Lori Jennings, the Deputy Director of the Good Housekeeping Institute, and Dr. Paul G. Matthew of Harvard Medical School join me with treatment options. Good morning.
Good morning.
So that's crazy numbers to think that many people are suffering for that amount of time. Lori, let's start with you.
Yes, absolutely. And that's why Good Housekeeping is here, because we have a huge audience of women across the country, and many of them may fall into this statistic. So what we want to do today is help raise awareness and educate consumers around some of the things that you can do to get a great diagnosis, or not a great diagnosis, but get your diagnosis, and then also get the right treatment options.
Well, and I'd imagine that has to be the first step, is realizing, okay, this is what I have. Is there that big question being answered of why? What is triggering these?
So migraine is actually a genetic disease, just like high blood pressure and diabetes. So the sooner people realize that it's a disease, the sooner people can seek help and get appropriate treatment. Migraines are extremely common, affecting 1 in 5 women and 1 in 20 men. And migraines can be very disabling. Not only is it the disabling pain, but also light sensitivity, sound sensitivity, nausea, vomiting. And all these symptoms certainly can cause someone to not be able to pick up their kids from school, not be able to complete housework, not being able to go to work. So truly a disabling disorder. And fortunately, with the right diagnosis, the appropriate abortive and preventative treatments can be instituted. And again, the physician to be seen to make the diagnosis is oftentimes a neurologist or a headache specialist, who is someone who's specialty trained and or board certified in headache medicine.
When do these normally kick in? You just mentioned kids, picking up your kids from school. How young do typically these symptoms start and we start realizing that somebody's going to have an issue with migraines?
So migraines can start as early as childhood. Although more frequently they can occur during the teenage years and 20s. And then they can be variable over the course of someone's life. I often bring up the idea of triggers, where if you are under more stress, lack of sleep, missing meals, dehydration, all these things can serve as headache triggers. So if this is where you start your day and this is what you need for a migraine, if you're sleep deprived, if you're under more stress, if you missed a meal, boom, a migraine will show up. Now, certainly migraines can occur without some of these triggers, but more commonly they'll occur with the triggers. So what a good preventative treatment does is it actually raises that threshold so you can deal with more stress, sleep issues without necessarily tipping into a migraine. Now, medications come in the abortive form. I have a headache, I need to take something to treat this headache, as well as the preventative form. This is something I'm going to take on a routine basis to prevent the headaches from coming on. So two of the older preventative treatments, which are orals, include topiramate and propranolol. These can often cause side effects like lightheadedness, low blood pressure, tingling, as well as cognitive issues. Another option is Botox injections, which was the first treatment approved for chronic migraine. And Botox injections involve injections once every 12 weeks or 4 times a year. And many of my patients would prefer to get a series of injections 4 times a year than having to suffer from frequent disabling headaches.
Wow. Well, Lori, let's send it to you before we wrap up. I'd imagine this is what we want, people to talk about this.
Absolutely. We want people to, first of all, be ready to talk about it with their doctor, with their friends, with their family. And then, of course, if there is more information, or if you would like more information, you can visit BotoxChronicMigraine.com, which is a great resource where you can also even find a headache specialist in your area. So lots of great information there as well.
You can also check out the American Migraine Foundation website, which also has some great resources.
Perfect. Thank you both so much. We appreciate your time today.
Great. Thank you for having us.
Take care.